to present Dr. Francisco Lozano from Mexico. He's a dearest friend. And Dr. Francisco Lozano is a professor of traditional Chinese medicine, acupuncture, and moxibustion at the National Polytechnic Institute's School of Medicine and Homeopathy in Mexico City. He has more than 35 years of experience in the study, clinical practice, research, and education of acupuncture in traditional Chinese medicine and acupuncture. Dr. Lozano studied Chinese medicine in China at Beijing University of Chinese Medicine and in Japan at Osaka Medical College Spain Clinic and Oriental Medicine Department from 1981 to 1988. In 2011, he earned a doctorate degree in traditional Chinese medicine from Beijing University of Chinese Medicine. He has worked intensively in the study and research of the physiopathology of several chronic illness and the integration of Western and Chinese medicine. So his topic is going to be the holistic and integrative practice of acupuncture and related techniques for disease prevention and health maintenance. Dr. Lozano, the floor is all yours.
Thank you. Good morning, everyone. Thank you, Marcia. Thank you, Constantina. Thank you, everyone, for being here. I have the pleasure and the privilege to be this morning with you and to share some of the experiences, some of the concepts that I've been working on for more than 40 years already. And these webinars topic, prevention and health, I think is one of the most important things that nowadays we need to focus on. And I will share with you some of the theoretical background, some of the concepts that I've been applying on my clinical daily practice. And I will show you some examples of how is the way in my day-to-day practice I pretend to do this important job to prevent and to do the health maintenance through the patient's life expectancy and everything. So let me go ahead and share with you this information. Oops, wait a second. I'm going to this part. Okay, here I go. Sorry. Okay, we were supposed to live beyond 100 years and to still keep on working and maintaining a certain level of health. I'm sorry for the orthography, agility, and to be able to move and do things properly even until we reach that old age. But it looks like disease progresses much, much faster than the awareness of to need to practice certain types of prevention. It is not only vaccines which will do the job of prevention. It is a job that we have to work on day by day in our practice. And through the techniques, through our theoretical background, we will be applying certain aspects that will make always our job to have a better impact in our life. One of the things that I've been always pointing out is this aspect of being treating the patient as a whole, the more integral concept, emotionally, physically, and organically. So if we see the body as a whole, just by doing that, we will be already doing certain type of prevention, because it is not only to treat the main complaint, but always approach the patient as a whole and offer them much more than he is looking for in one way or the other. So we will need to center our practice more in prevention than anything else. Through doing prevention, of course, we will be avoiding the development of certain diseases. We have this, we already talked about it, and Constantina already pointed and stresses a lot of what is the situation of diseases in worldwide, and why we need to focus a lot on the prevention approach. But here is the real thing is that we are in a specific transition epidemiologically where we have an aging population. more and more elderly, and we need to not only to treat those patients, but also and to guarantee a better quality of life, to have to offer them more well-being in general, and to let them reach that age or be on that age in a much appropriate manner. We are facing the rise of non-communicable diseases like cardiovascular diseases, diabetes, cancer, mental disorders, dementia, and other things which are always impacting the health of our population worldwide. And we need to do those things. We know what is the tendency. We know how it's going to happen in the coming years. So that we need to apply different strategies. I know that medicine in general, we have the technological advances, with the scientific research, they're always doing the best to include strategies to not only to treat diseases, but also to prevent disease from developing. But sometimes we are kind of hands tied, and we cannot offer as much as we could. Here, we have a life expectancy of 71.4 years, but how are we living to reach those years, that age? Are we doing the proper thing? Are we going to be able to reach to that age or even go beyond that? So that will depend on how we live our lives, how we have a preventive health care, how we improve our quality of life, and then we will probably be able not only to reach 71.4 years, but to go beyond that, as I said. So then, prevention is the main topic. We need to reduce morbidity and mortality. We need to improve quality of life. We could increase life expectancy. There is always a job to optimize healthcare resources. And this is one thing. Premature aging is a way of saying that to have a healthy aging. We are focusing on reaching that age in a more acceptable and with more quality of life, in a much, much better condition, that we not only be able to enjoy and to have a well-being in generally, but also it will reduce the cost for the health care for those elderlies. So we need to promote access to healthcare. It is always a problem in several countries, in several conditions. So then again, prevent is the word. And it's been said that the great physician, a good physician, not only treats diseases, but also focus on prevent the disease from arising. So this is the main aspect that we have to look at. We have levels of prevention. Constantina already added one, the quaternary prevention, but well, here we are. There's nothing new. That we depend where we are, where the patient is individually. So we need to do this, whatever prevention focus on. Many times the preventive medicine was taken as to do only vaccines and to improve nutrition and do exercise, which are the task or the things that the patient has to compromise and doing for his own health to prevent disease from appearing or from developing. Once you have a certain disease, you have to follow certain instructions from your physician in order to help your recovery or prevent from getting any other complications. So, well, we know that we have different levels to act on whether the disease is already there or it is in a stage where we need to maintain the regular well-being in general for those different states, and to be able to recover fully, or at least a certain percentage that improves quality of life. So here are two concepts that have been already popular in generally, the sub-healthy, and I kind of tailor this different concept of pre-state, where both these two concepts refer to a state where the disease has not yet fully expressed, or the patient is not aware of it, he has no particular things, or we are, as I said before, we are in a certain stage where even the disease is there, we are in a state where it is still possible to stop it from progressing, or we can still, without even having the label of a certain disease, we're able to prevent it from appearing, from triggering, or from being complicated. So I will go a little bit more in detail in these two stages, but preventive strategies are needed. We actually, even if the patient says that he's okay, that he has no symptoms, and he's healthy, especially as I will stress a little bit more, is that even laboratory findings are normal. If there are no clear symptoms, the patient is in a borderline state. And through Chinese medicine, that's where I go with practice of acupuncture, herbal medicine, TCM in general. We're able, through the pulse, through the tongue, and even with many other symptoms or clinical manifestations which are considered not very important in general for the patient and sometimes even for the physicians in modern medicine. So we're able to create or to tailor a pattern of disharmony where we can start the treatment in this sub-healthy state. So there are preventive strategies that we could implement because we can arise with a particular disharmony pattern like spleen qi deficiency, liver qi stagnation, or any other thing, that from there we can start giving a particular acupuncture formula for treatment, and also we can design a particular herbal formula to start the treatment. And even we will not expect necessarily the patient has a clear change in his life or in his health state, because probably he will deny that he will create a state of self-consciousness that is okay. But when he starts receiving a treatment, preventive treatment, something changes, improves quality of sleep, improves bowel movement, or the quality of other functions, more energy, exercise is well tolerated, and even sexual improvement, any other different changes that he was not expecting to could get through this treatment, that are putting this patient to stay in not only in the healthy state or the sub-healthy state, but even to have a better quality of life. Then the pre-state is a little bit, it has certain similarities to the pre-healthy or the sub-healthy state. But here we are considering that the patient might already have certain manifestation, but he has not get the label of diabetes, or he hasn't really fully developed high blood pressure, but he's also in a stage where the disease can really arise fully with a lot of symptoms and deterioration of quality of life, definitely. So, as I said here, we have different pre-state levels, I could say, like the pre-disease, pre-symptom, pre-syndrome, pre-dysfunction, and so on. Then we could start prevention for this to appear or to develop. And we could also, from here, we can always have a lot of symptoms and different expression of disease through the tools of diagnosis of Chinese medicine, or even, of course, here we could also have or use anything that we could get from Western medicine, laboratory findings or imaging, anything. We could also get certain aspects that will put that patient in where we could design a prevention treatment. So, like some of the typical diseases that we could associate with this pre-state. So before they develop arterial hypertension, ischemic heart disease, or rheumatic or immunological diseases, hormonal, before they enter they are already in the climacteric stage. So instead of developing a full developed syndrome, then we could start treating the patient when she is on late 40s or early 50s and so on. So we know that the patient is there even though she or he hasn't developed a particular disease or symptomatology that could be given the label of that particular disease. So then I will focus a little bit more on what is what Chinese medicine has to do with this, and then I will also share with you some of the proposals for this preventive and maintenance approach with different acupuncture and herbal medicine strategies. So here again, the value of prevention in traditional Chinese medicine was given since ancient times, where definitely the task or the obligation of the physicians were to keep the patient healthy. If they could keep the patient or the community in good shape, then they will be paid for. Otherwise, they will need to work harder and to bring the patient back to the normal stage or to be healthy, and even without receiving any pay. So the most important thing was to prevent illness from arising again. So today in the TCM, in traditional Chinese medicine, with acupuncture, herbal medicine, and other related techniques, offering an integral, holistic approach, then we are centering on bring back harmony to regulate function and preserve health. This is again the general concept. We in Chinese medicine, even instead of really going strictly to point on a particular disease symptom or a ailment, particular pain or whatever, most of the approach of Chinese medicine is not like center in symptoms or center in one particular lesion or damage, but it's more on regulating harmonization, do a maintenance that will definitely act on the prevention that we are stressing all the time. So like guarantee the flow of blood and qi, regulate excesses and deficiencies, that also pay attention to the flow of the emotions. There is a function of the liver that is shu xie, that is regulates the emotional well-being in general. So that is very important in order to prevent disease from occurring. If we do not center on those aspects, disease could easily arise. Then, like some of the most popular strengthening or preventive measures on Chinese medicine is to strengthen the vital qi, the cheng qi, which is the one that protects us against other pathogenic factors. To strengthen the main organs, kidney, liver, spleen, as the three probably main organs, to keep the body in power and protected, avoiding the malfunction and disease occurrence. Of course, Wei Qi, the defensive Qi, to help from external factors, and always keep the balance of blood, Qi, Yin, and Yang, and essence, right? So these also, nowadays, it is being proved somehow through scientific research that through acupuncture and herbal medicine, even you could measure, you can actually find these changes on different levels, even to promote tissue repair and regeneration, regulate endocrine system, metabolic system, secretory system, neural or humoral functions, and then to improve, strengthen, or modulate the immune system. And again, another way that through TCM we could have some guidance to what we have to do in order to prevent disease from occurring or from developing is if we identify clearly that we have certain specific critical stages around our life cycle, then we know what we could expect. Like, what is the most common things that happen in childhood? What are the main patterns that will appear on that stage? Then we will be able to strengthen those.
10 minuten.
Okay, and okay, and then well, again, here are is an example of what if we know what is going to happen on those stages of life, then we know what to do. Aging here as at the end of this arrow, old age, and then aging is one of our focus, right? To prevent aging or to have a healthy aging in one way or the other. So we this is what is happening. Aging is a process where there is a decline in organic function, blood stasis gradually creates, the water metabolism is impaired, so the formation of phlegm is occurring. Then toxic heat, which are like the metabolic things that happen after metabolism, the yin weaker and weaker, and also gradually the yang starts the declination. So there are.
Francisco, I would like to make a correction. You have 15 more minutes.
Yeah,
according
I
to the
knew
program.
that.
Sorry.
Yeah, I knew that. I was scared a little bit. Anyway, there's still a little thing more to do. So then these are some therapeutic principles applied to that particular process of aging. But of course, this is some of the strategies that we will need to apply, or these are the therapeutic principles when we are already on that urge of the elderly. So since this is happening, so there are strategies to prevent it. So aging is inevitable. Still, premature deterioration can be prevented. So have a healthy aging. Now, I'm focusing on Chinese medicine in one way, but as I started, this is a holistic and integrative care that we're looking for. So even though the cornerstone of this modern integrative of TCM is important, this means that it's integrated with Western medicine as well. So to what extent, which is the most important, it doesn't matter. Both will put the best of the both systems. So here, for instance, is like through modern medicine or Western medicine, we have these tools that we could make a lot of contribution to evaluate the state of health. And through TCM, we also implement certain concepts that will help us to put it together and have a more integral and more integrative and holistic approach. So we have more from different aspects we could always contribute for the patient well-being. This is the integrative care model that we will probably be able to create, do diagnosis through Western medicine, pattern differentiation from TCM, and we have to identify what the risk according to the stage of life. We will be able to evaluate if the patient is in a sub-healthy or pre-state, and then we will always encourage the patient to do periodical and continuous health maintenance program. That is, it will not come only for one particular session to treat one particular symptom or of one part of the body, one joint or one organ, but the body as a whole, and always in a maintenance program. So we do a preventive intervention with acupuncture and related techniques. As I like this approach of the 4-piece medicine model, which is very similar to what we do in our TCM practice or in acupuncture and related techniques practice, I should say. I mean, medicines should be guided from these particular approach, I believe, through the tools of the technological anything and inheritance, genetics. Now we are able to predict. And of course, in TCM, as I mentioned earlier, there are several things that we could use in order to see what is the stage of the patient and to predict things from happening. Sometimes through pulse diagnosis, tongue diagnosis, from some clues, signs, and symptoms, we could predict what is going to happen next, what is going to be the path of disease through the ages. So we have to do interventions for prevention. The preventive, again, Western medicine or modern medicine has tools to identify and to do some preventive strategies as well. And in Chinese medicine, through these particular things, as I mentioned before, balancing blood qi, yin and yang, strengthening the Cheng qi, reinforcing wei qi, and so on, we are able to have a preventive approach. Personalized is very important. Individual, the treatment has to be tailored to the individual. And so seeing the patient as a whole, recognition of certain patterns of imbalances is very, very important. And yes, patient has to participate. The physician-patient relationship is one of the most important things in order to the patient to understand and to be able to be responsible for his health care maintenance. So the main goal is to stay in the optimal health state. And of course, we always have to talk with the patient and promote a better lifestyle, proper lifestyle, education on and exercise and food. So, and adapt this to the personal circumstances, the life stage, and it requires a particular level of care. And as I mentioned earlier too, I always promote a continuous maintenance therapy. Let's say come to acupuncture and herbal medicine every 2 weeks or monthly. At the beginning, probably will start coming every week. If it is something acute, we will probably need to do more often, like even twice a week. But usually 1 week, weekly treatments every 2 weeks or monthly as a maintenance therapy is recommended. So here we share with you some examples of what I do daily, and this will represent some of the strategies to harmonize, to regulate, and to prevent. This is some good examples that I know you're familiar with most of them, but even Susan Lee and Trung Wan, Susan Lee as the longevity point, and Trung Wan, which is center on earth, is center on the center of the body, and the school of the earth in Chinese medicine. They say that everything arises from disharmony on this element, on stomach and spleen and stomach. So these are those two very good points in order to do a permanent regulation, permanent harmonization, permanent strengthening. I have been taught from a Japanese professor to check on the back for certain indurations that they call blockage, qi blockage, or indurated yin tian, which it's good to check on those very gently. And once you identify them, you have to do a release, a block technique with a gentle dispersion technique. And that helps a lot, not only to bring comfort to the patient, but also helps to improve the overall treatment you have given. So many times, even though I have a particular formula of acupuncture points, many times I end up the therapy of that day, this acupuncture session, with some unblocking or releasing the blockage on those particular points in the back. It could also be applied to if you find particular ashy points. Then regulate Renmai and Tumai. These are most of the most important points on those two channels that will always be on the center of our treatments. Definitely, these are very frequently used points that will always create a flow and harmonization of these two particular extraordinary channels, which have a lot of important in several diseases. And if you have an harmonization and regulation of those two channels, also you could guarantee better stability and prevention. Strengthening the back, those 2 points, the acquired energy and the congenital energy, the essence, Pishu and Shenshu, these 2 points are very important also to strengthen the body resistance and to maintain health. Of course, most of the diseases arises from the qi blockage, and we have to promote that. And upper and lower, yin and yang, left and right, interior and exterior, Tang and Fu. So these 4 points particularly are the most frequently used points in my practice. You could combine Kunswen with Nequan, which not only is a good combination of the spleen and pericardium, but also starting from Kunswen specifically, it regulates the sea of blood and also the movement of qi. It prevents also the reverse energy to go up. And Hekuan Tai Chong is also a very good combination for energy flow. So always keep this in mind. These are 4 points that will always prevent energy from blocking, and also will act on emotional regulation and many other functions that will guarantee a better quality of life. Again, the upper and the lower sea of energy, Shanchong and Qi Hai, connect those 2 points. It helps a lot of course, for chronic diseases, especially lung diseases, chronic lung diseases, and also to continuously promote the flow downwards of qi even from the the concentration of energy on the thorax and on the chest, that will also create the moving through genitals and through the lower extremities. It's also very important to do this combination, for instance. The extraordinary channels, which focus on regulating the 12th meridian, to mobilize essence, the jing, which is very important, and to do a treatment on symmetry and balance. They work very good on this particular thing, which is promote healthy aging, promote a well-being, promote stability, and prevent disease from happening. This system of extraordinary channels goes very good on following the life transcendental cycles of 7 and 8 years for men and women. Again, balance, harmony, regulation, and prevention. And some of the points that you are familiar with, but I like the number 13, and that's why I find specifically 13 points which are essential. Actually, you could say that you could use at least some of them in everyday treatments for your patients. But many times, it's not that you have to do all the 13 at one time, but think of them, what are the main functions which are pointed there. I'm not going to repeat what is written there, but you could see some of the specific things that I pointed out for each particular point. They are really well selected for maintenance and prevention, to regulate, to harmonize, to strengthen, but to prevent disease from developing or complications. So, and then I wanted to add some of I pick up 4 very popular and important formulas for Chinese herbal medicine, which I believe that this is one of the most used formulas in Chinese herbal medicine. I say that this particular formula goes well, specifically on that age from between the 20 years of age to 50 years of age, let's say. Because the pattern that it happens at that particular stage of life, it goes more for liver and spleen disharmony. So every one of the products of this formula have a specific function that goes very well for what I was saying. So, and yeah, definitely you could use this formula even in childhood or in elderly, but it goes well on that particular stage of life that I mentioned. This is a very popular formula too, the jade white cream powder, Yuping Sang and Yuping Fong Sang, which is a very clear example of prevention. It strengthens the Wei Qi and prevents the external factors to enter the body. So these just 3 herbs will do a great job. You can always combine and adapt any of these formulas to the particular needs of a patient, but you have to keep these 4 formulas on mind. Then the second, or for somebody will be probably the most used formula in Chinese herbal medicine is the Rehmannia 6 formula, or Lu Wei Ti Huan Wang. But well, here again, it is a very well balanced formula. Actually, the formula itself is an example of balancing, promoting, reducing, strengthening, and dispersing. Creates not only tonification, but also reduces the excesses, reduces fire or heat, and it reduces dampness. It's a great formula that it is mainly for the ages from the 45 years of age to 60 or more. But you could always put any other, add any other herbs to adapt to the patient's particular needs. It's tailored to individual needs. And the last one, which is generate the pulse, also a very simple formula, which is specifically for Qi and Yin. Not only heart and lung, it also goes to the kidney and also goes to the spleen and do many other things. But yeah, it is said that it recovers the pulse or generates pulse. But this formula also is very important because most of the chronic diseases, the main pattern is the Qi and Yin deficiency. So this is a very great formula to cover that, strengthening the Qi and nourishing the Yin. So for chronic diseases in general, or of course lung and heart diseases, this is a very good formula to use. And final remarks, and I'm finishing. Yeah, that we can start the prevention in any stage of life, and the earliest the better. The preventive care must be individualized, holistic, and integral, or integrative, I wanted to say here. Acupuncture and TCM are not merely helpful therapeutic resources, but this is a whole system in itself with diagnostic, clinic, and preventive foundations that will be easy to apply in our daily practice. So this health maintenance and prevention, which is the main part of this talk and the whole webinar, is, I think, they are very important pillars for traditional Chinese medicine. And yes, these two concepts of sub-healthy or pre-state must always be taken seriously as if it was already a disease manifested, fully manifested. So think of this and apply strategies to prevent and to maintain health. This is it. Thank you.